Hello and welcome to the Arise interview, where we take time to reflect on the big stories from the news and on the fortunes and affairs of the world in an hour of conversation with commentators, analysts and thought leaders. I'm Sumner Sambo. Coming up in the next 30 minutes, today Christmas is celebrated all over the world. Christians celebrate the birth of Jesus Christ, but due to the coronavirus pandemic, this year's celebration is different. Traditional Christmas decorations are still being admired and families were still able to meet and church services took place, but with certain restrictions around numbers, social distancing and the use of face masks. So how are Christians celebrating Christmas in the COVID-19 era? And what's the essence of the celebration? We'll speak to a clergy. And later, as another new variant of the novel coronavirus seems to have emerged in Nigeria, the head of Africa's disease control body is calling for more investigation. The news comes as cases surge in Nigeria and South Africa. It was learned that the new variant found in Nigeria is different from the ones found recently in the UK and South Africa. Medics do not currently believe the new strain is more infectious than previous strains. Scientists say more time is needed to study it. Can such a new variant affect the ability to fight the virus? And how can Nigeria tackle this second wave of COVID-19? We'll speak to an infectious diseases expert. Christmas in Nigeria is a family event, a time when lots of family members come together to celebrate and have fun. Most families that live in cities travel to the villages where their grandparents and older relatives reside. But this year's festive period is a different one due to the coronavirus pandemic. Nigeria's President Muhammadu Buhari had cancelled the annual official Christmas ceremony for this year as the country fights off the second wave of the COVID-19 pandemic. However, families were still able to meet and church services took place, but with certain restrictions around numbers, social distancing and the use of face masks. Christmas is described as a good time to give to others, both Christians and non-Christians, and a good time to offer gifts in the name of Jesus Christ in appreciation of his love and mercies. The Pope's Christmas Day address was a call on countries around the world to ensure COVID-19 vaccines are made available to those most in need of them.
Di oscurità e incertezze per la pandemia appaiono diverse luci di speranza.
Today, in this time of darkness and uncertainty for the pandemic, several lights of hope are appearing as the discoveries of vaccines. However, for those lights to lighten and bring hope to the whole world, they must be made available to everybody. We cannot allow that isolated nationalism forbids us to live as the true human family that we are. And we cannot allow the radical individualism and virus to win above us and to make us indifferent to the sufferings of our brothers and sisters. I cannot put my own self ahead of others, putting market laws and patents above the laws of love and health of humanity. I pray for all those in charge of nations, companies, international organizations to promote cooperation and not competition and look for a solution for everybody, vaccines for everybody, especially for the most vulnerable and needy ones in every region of the planet, at the first place the most vulnerable and needy ones.
All right, for more insight on the essence of Christmas celebration, I'm now being joined by Bishop Jonathan Maji, who's the presiding bishop at the Springs of Life Resource Center in Abuja. Good to have you, Bishop.
Thank you so much.
How is this, Christmas being celebrated in churches generally across Nigeria? I mean, you're of the Pentecostal faith. How is it being celebrated, and what protocols did you observe in church? And did your members actually follow those protocols of COVID?
Well, thank you, and welcome viewers. It's wonderful to have us come here today to discuss the uniqueness of today. We all know that this year, and even though last year escaped by the whiskers, but this year we are being trapped in another wave of the coronavirus, whereby the whole celebration had been banned. For us, we are not surprised, actually, because in Matthew 24, the Bible has spoken about what we expect in the latter days. When we begin to see things like this, we expect them. We have always been on the lookout because they actually fulfill the program and the timing. In some places, services were not held. Other places, services were held, observing the protocols as well said. Most times I keep saying the Bible enjoins us to be very obedient to the laws of the land. So definitely it has not always been as it were, because this time around it's been characterized by what we have all been experiencing, the pandemic, the COVID-19, which has another variant coming up today. So we are doing our best to make sure that we keep
this will not necessarily be new, because even the Bible has always talked about plagues and all of that.
Like we even expect something bigger and heavier than this.
All right, well, what do you say about some of your church members who may not want to believe in this, and when you ask them to wear face masks, they tell you no? Or when the ushers ask them to actually, sneeze using their elbow or wear some face mask, they refuse
usually
to do that.
Like what we began doing early this year, it has brought us to the fulfillment of the prophecy in the book of Daniel chapter 12. The Bible says in the latter days there shall be increase in knowledge. And we are face to face with digital technology, and most of these things are coming forth in the face of this advancement in knowledge and education. Most times earlier this year, when I noticed that holding on to the protocols might have brought us more difficulties and danger, what we did was just to shut down the church completely, and I was talking to the church through digital means, reaching out to them, as many that could reach. We just sit down, listen to me wherever they are until we are restored back. And even while we are still having the services before any notable information may come around, we are very much observant to the protocols that the government have set, so we don't have problems as per what the members, they have always been very obedient to any instruction we pass across to them.
Let's get to the story of Christmas actually.
Right.
What does this day mean to Christendom? There have been some people who have said that today, 25th, is not the actual day that Jesus Christ was born and all of that. But what's the significance of the celebration of the birth of Jesus Christ?
Well, the significance is really reminding ourselves about the coming of light. Isaiah says, "For unto us a child is born, offspring, and unto us a son is given." You look at the child and the son here is steward. When the Bible talks about a steward, it's talking about somebody who is coming to work and restore back the structures of the kingdom. And he said, and the government shall be upon his shoulder, which means that he is coming with an empirical system of governance, which is an empire. The Hebrew call it Menshallah, which means that he is coming to establish the structures he had established from the beginning of man. And then when he comes with this governance, with these structures, he will be known as a wonderful person, because he is God. He's omniscient, he's omnipresent, and he is omnipotent. So he's coming as wonderful, all right, miracle worker. He knows what to do best. Whatever he does is for him, and it lasts, and it's for his pleasure. So he's not to be questioned. Number two, he said he's going to be a counselor. He's establishing an advocacy system. As in Isaiah, the Bible said the Lord is our lawgiver, he is our judge, and he is our king. That's the three arms of government.
Let's take a look at this this Christmas within this pandemic. I mean, it's like the very first happening to Nigerians. A lot of people are disillusioned. What kind of message are you giving to them? You heard the Pope right now saying that advanced countries should ensure that the COVID-19 vaccine that will be coming will be made available to all nations, not hoarded by the bigger nations. Right. In these times of anxieties, how can that message actually sink to political leaders in different countries?
My message will be that nobody should be taken by surprise, because it has been foreknown by God and prophesied. You know, prophecy and foreknowledge are two areas. Okay, so we should expect it, because this is not going to be the first Christmas. We have had hundreds and thousands of them, and now if this had to do with keeping to the protocols that we need to keep us safe and save our life, why not?
Okay, why not? The Pope's message actually that this COVID-19 vaccine that has been discovered should go around the whole world, to the poor, to the needy, and everyone.
Now, will I say, my suggestion would be that it will only be used on those that maybe have been discovered to have it, or because when you generalize it, is it going to be used on those who are not discovered to be infected?
It's meant to be for everyone. And some people have said that they are not going to allow their church members to accept those.
Right, because that is the...
Would you allow your own church members to accept?
That is the argument that is going, because if I allow it, I have to seek the counsel of an expert, and he must have to prove to me, because there are quite a number of videos out there, quite a number of expertise are talking against it. And so we who are not experts in such fields, who are only here to deliberate on supernatural issues, teach people how to focus on God and bring the life of God to... I may be a novice in that area, and it will be difficult for me to just allow somebody to just go in. So I will need an expert's opinion to go on this.
We're running out of time, and we just need to tackle some issues. How tough has this year been for Nigerian Christians, considering that a lot of the things that happen for the running of the church come from collections, and a lot of churches were shut down for long? And how do you foresee 2021?
Yeah, it is a time, I mean, it's a testing period for everybody. It has been a very tough period. Okay, like I said, I repeat again, fulfilling the prophecies of God. Paul said to Timothy, but notice that perilous times shall come. So we are in this period. Life and strength trying times. These are times when everybody... It has not been easy, because when you have to stand with an economic system that does not work in your favor, you have to go looking out for how to fend for yourself. You take care of your children, you take care of dependents, you take care of your workers, and you have to make available everything. Sometimes you have to increase the pace of welfare. It's not been easy, because sometimes you have to seek stimulus somewhere.
Yeah, even some of your church members have besieged churches seeking for help because the government has not provided palliatives and all of that. How did you cope?
I remember when the church members were asking me questions, how do we get palliatives? And I tell them that this is a system where subventions are not given, our welfare and charities are not returned back to us as it were, or it is in other nations. So we have to do the little we know we can, and instead of giving out to everybody, we have to seek just the fewest of all and the most vulnerable, all right, and then begin to help, and then plead with those that we cannot be able to reach, because it's not easy.
Quickly, how do you foresee 2021 for Christendom and the nation Nigeria?
I don't foresee it to be easy with the new variant that is coming, because we only depend and wait on God, because the Bible says, they that dwelleth in the secret place shall abide under God's
we do not have enough time.
Thank you
so much. Watching the Arise interview, plenty more still coming. We'll thank Bishop Maji for joining us on this segment. Thank you so much for coming. Where we hold the best of conversations and analysis. Another new variant of coronavirus has emerged in Nigeria. Africa's leading public health officials have said the strain is emerging as Nigeria reports recorded numbers of coronavirus cases, with 1,133 recorded on Wednesday, though the new variant is not thought to be behind the COVID surge in the country. According to our sister publication agency, This Day Newspapers, a senior official of the Federal Ministry of Health says the new COVID-19 variant has not yet become a major threat. The head of the Africa Center for Disease Control and Prevention, John Nkengasong, says the variant found in Nigeria is different from those found recently in the UK and South Africa.
How dangerous this virus is, this is what we know about the virus so far. It transmits quickly. That is why it's actually responsible for a vast majority of the second wave in South Africa. The viral loads are higher that is the burden of virus in an infected individual is higher amongst people that are infected with this variant.
All right. Well, for more on this, I'm now being joined by Professor Bolaji, an infectious disease expert and public health specialist. Good to have you. And how have you been coping yourself? I mean, because you're not immune from all of this, despite being an expert.
Yeah, I mean, we're not all immune, so we all have to do what we need to do to prevent transmission of the infection.
Now let's talk about this strain that's coming up. A lot of persons have have been in panic mode since we started hearing of this strain. One of the researchers actually said that it had been with us since August, and now we're hearing that looks like there's another strain differently from that, and it looks like this one is different from that of South Africa and that of Britain. How should an average Nigerian actually look at this issue?
Okay, so in terms of having the variants, I really won't call it a strain because we don't have a different strain, we have variants. But these are things that happen naturally in viruses, because viruses, as they reproduce, they get new mutations, and those mutations may bring about variants. So there has been news that a new variant was discovered in Nigeria, okay, but we don't know anything beyond that. Africa CDC made a telebroadcast, but our Federal Ministry of Health and the NCDC have not said anything about that. But for me, I think what is important is that irrespective of what variant it is still the SARS-CoV-2 that causes COVID. And what's important is how do we reduce the transmission of this infection? And that is really what we as Nigerians need to focus on. Unfortunately, a lot of people are not doing the simple basic things that will prevent transmission.
And that's because they did it sometime back when we had a lockdown and all of that. And after the lockdown, a lot of people just said it wasn't existing, and they still don't believe it is existing.
I really don't think they did it during the lockdown. One of the gaps that I saw during the lockdown was that there wasn't enough awareness to the people on why there needed to be a lockdown, what the lockdown was meant to achieve, and what we needed to be doing irrespective of the lockdown. But that message now needs to go out more than ever before. What should we as Nigerians be doing to reduce transmission of COVID? Whether it's this variant, whether a new variant will come on, it's still going to be the same prevention measures that we need to put in place.
One of the major challenges that we have is that testing remains very, very minimal. Only a very few states are testing fully, despite the increase of labs. And a lot of Nigerians don't want to even subject themselves to this test, and it's very expensive. What do you think we can do to encourage more testing?
Now, if you say it's very expensive, the one with regards to public health response is actually free. You don't pay for that one.
Yeah, the queue is so long that you wouldn't want to wait yourself.
I think there are quite a number of things that we need to understand. I think our states actually need to get up and take responsibility for taking care of their own people. Yes, you have a lab, but you need to pay the workers. You need to source for the reagents. And I think these are some of the challenges that states have not taken responsibility of. So what happens is a lot of samples are being shipped from many states to 1 or 2 labs, which also means that there's a delay in testing. The other thing which you mentioned, which is important, is the fact that people are not even going for testing. And we need to encourage people to go for testing. You know, it's like they say HIV no they show for face. The truth is, even COVID, until you test, you really don't know. And one of the challenges we have at this time is that when people have fever, upper respiratory tract infection, they'll say it's due to the change in weather. But it might not be.
Yeah, I mean, it's happening so much. Yeah. Myself, not quite long. I had this, and then the first thing someone told me is that it's because of the change of weather. Don't be scared, it's not COVID and all of that.
Yeah, but it could be, and you would not know except you test. And the reason why it's important we test is that if you don't know you're positive, you're going to go around sharing it to people.
Yeah, that's but we have a youthful population, and this is not active among the youthful population. So because of that,
no, we won't say it's not active.
They just feel it's actually something for the elderly to be afraid, not for young people.
No, but we have young people who have died from COVID. We have children less than 1 year who have died.
Not so much
COVID.
In Nigeria.
No, I'm giving you Nigerian data now. I'm not talking. There may not be many, but you see, if it affects you, if it's your child, if it's your parent, it would mean a lot. So we still have people below 5 years, below 1 year who have died from COVID. There may not be many, but they are children, they are lives that matter. And you never know who the next one will be. And so that's why we still need to keep making efforts to prevent transmission of the disease.
Let's look at the plans by the Nigerian government to actually acquire, any of the vaccines that have been, introduced globally by different pharmaceutical companies. What would you advise Nigerians to do? Should they start preparing ahead of that, hopefully maybe from January? And there's also this controversy whether citizens should accept that vaccine or not, based on religious or political or even social beliefs.
Well, one thing is that vaccines are the best prevention that anyone can have, especially if the vaccine is effective and it works. I mean, that's why, for example, during meningitis, you take meningitis vaccine. That's why if you have a wound, you want to take tetanus vaccine, because we realize the importance. So vaccines are actually important, and people should have that mindset that vaccines are the best prevention we have. Of course, like anything, even paracetamol has its side effects. So some vaccines may have side effects, but I know that what's happening is that there's a lot of efforts. The World Health Organization, even the vaccine companies themselves, are making a lot of effort to make this as safe as possible for people. They're doing a lot of trials. We already have people in UK and in the US who have taken it. They're still being monitored to see what may come out of it.
Yeah, so would you take one when it becomes available?
I would. I actually would.
Okay. Now let's also talk about the politics of some state governors actually saying that this doesn't happen. We've seen Kogi State governor making it even a state policy that it doesn't exist, and so he wouldn't allow NCDC officials into the state. What would you advise citizens in that state to actually do?
You know, there's this saying about an ostrich that buries its head into the ground, to say that because I cannot see, no one can see me. But the ostrich being big, yes, the head is buried under the ground, but everybody else sees the ostrich. I think at this point in time, people should not, you know, just want to say because I've said something, I'm taking a stand. Everybody is allowed to make a mistake. In life, we learn and we move forward. So if people have made utterances in the past that were mistakes, they should be man and honest enough to say, look, we thought this wasn't happening, but the dynamics have changed. But I can tell you that COVID is real. I've seen people who had COVID. I know people who have died from it. And so COVID exists, and we all need to put our hands on deck to work on reducing
Just before we go,
transmission.
very quickly now, what will you say about the global politics of the vaccine distribution and all of that? Some countries don't want to sell it to Africans and all of that. What should be done by Africa and, for example, Nigeria to access such vaccine?
I wouldn't say they don't want to sell it to Africa. You know, the way it works is there are countries who have paid money in advance, and so, you know, it's a business in a way for the vaccine producing the manufacturing companies. So if somebody has paid, they get served first.
Oh, okay.
But the World Health Organization developed in conjunction with Gavi and CEPI, they have what you call the COVAX facility.
Right. I'm told we do not have enough time.
Okay.
So definitely it will be sold once it's completed.
The aim is to make access available to
all
all
right.
countries.
Thank you so much. Well,
Okay,
I would want to
you.
thank you, Prof, for taking time to come out to be on the show. Well, that's how it's been for this edition of the Arise interview from me and the entire team here in Abuja. Goodbye and thank you for watching.